Hi everyone, and welcome to the class. My name is Audrey, and today we will be having a reading lesson. Okay, so for those of you who have not joined me yet in our reading lessons, we're going to take a look at an article and not only read the article and practice our pronunciation, but also focus on conversation. Okay, so a key point will be while we're reading this article, don't only focus on the new words that you're learning and understanding the individual paragraphs, but focus on understanding the entire meaning of the article. That way we can discuss the article together. Okay, so just as soon as we get some more people in here, we're going to get started. Right now is our premium period. So for those premium users, you can join right now. All others can wait just a few more minutes, and we'll get started as soon as everybody is here. So another mention about the premium users, if you would like to be able to reserve your spot in classes, you can become a premium member, and that will guarantee you a spot in the class. So sometimes spots fill up very quickly. If you're interested in reserving a seat, you can try and become a premium member. Okay, so of course that's a nice option. I'll tell you a little bit about our topic today. Our article is about healthcare costs. Okay, so healthcare is very different in different countries. I'm excited to see everybody's opinions about healthcare and to learn a little bit more about how it works in your own country. So as soon as everybody gets in, we're going to start with our introductions, and you can tell us a little bit about the cost of healthcare in your country. This can be a very controversial issue. Of course, here in the US, healthcare is a big issue as well. So I'm very excited to hear what you have to say. And in just a moment, you can go ahead and join. It looks like we're open. So everybody who has been waiting, please join, and we will get started in just a moment. Hi, Jean-Marc, how are you?
Are you right?
Yes, I'm good.
Do you have seen my links?
Yes, I saw your link. I listened to the song that you sent.
Yes, it's nice song.
Yes, I thought it was very nice. It's a very nice song.
For a future class. Why not because it's really interesting, not this song.
Yeah, I thought it was very nice. I really liked it. Okay.
Yes.
Can everybody else join the class? Maybe there's a problem. Is there a problem with the join class button? Are you a premium member, Jean-Marc?
No. I am not
Okay.
premium. I am not premium
Okay.
because I think I have no money because I am not Europe. I am a clipper. I think I give my bank, and after people give my number, and after me not my money in France.
Yeah, so there's two options. Thankfully, you can also join classes free if you don't want to become a premium member. Hi, Wanderson. How are you?
Hi, I'm fine.
Good.
Hi.
I'm afraid there might be a problem. There's no people in my class.
It's me, yes. Yes, I am here.
Yeah, I'm not sure if we might be having some technical problems with the other students. But I'm not sure.
I'm
We'll
sorry.
wait just a few more minutes and we'll see if anybody joins, and if not, then we'll have a small class, okay?
Okay. My camera is not working. It stopped working.
Oh, well, that's okay.
She's
Yeah.
coming, people's coming.
Hi, Mustafa. How are you? Are you with us, Mustafa? Maybe not. Your microphone might be muted. You can try and unmute your microphone in the top right corner. Okay, so let us know if you get your microphone fixed. Well, I guess we'll go ahead and start with our introductions. And of course, you in the chat, if you can let me know if you're having some technical issues, if you're having problems being able to join the class, let me know and I'll try to do what I can to get it fixed. But we'll go ahead and start and we'll see how it goes. So, of course, today is a reading lesson. The topic is about healthcare costs. So healthcare can be something very expensive, or some countries offer it for free. It just depends on the country. So as we introduce ourselves, it looks like we're getting more students, so that's good. As we introduce ourselves, tell us your name, where you're from, and a little bit about the cost of healthcare in your country. Okay, so we'll start first with Jean-Marc. Would you like to introduce yourself?
Yes. I am Jean-Marc. I am from France, and in 2 months I'm go to London. Next
Yes,
month.
wonderful. Next month.
Next end month. 30
That's
mars.
great.
30 when second is.
Okay, very good. And Jean-Marc? Yes?
Look, I'm waiting for you. Is it correctly?
Okay, yes.
Of March. 3rd of March.
Very good, very good.
14th March.
So you have less than a month until you go, right?
Yes, March, next 3rd March. Look.
Okay, very good. So Jean-Marc, can you tell us a little bit about the healthcare in your country, in France? Tell us about the healthcare.
Okay, what? I don't have a listing of.
Can you hear?
I don't have links of cours. I don't have. What's it? Long care.
Yes, healthcare. We'll come back, okay? We'll come back to you and maybe you can tell us a little bit more about the healthcare. But next we'll go to, we have, let me see, Mustafa, are you there yet?
Mustafa Nasif. Yes, this is me. Can you?
Okay, maybe Mustafa's having some problems. Let's go to Ronaldo. How are you, Ronaldo? I think we may be having a lot of connection errors. I'm sorry. I'm sorry for everyone who's having some problems. Mustafa, are you there now? Okay, let's go to Wanderson. Introduce yourself.
Yeah, my camera worked. Yep. My name is Wanderson.
Oh, now it does, yes.
Yeah, my name is Wanderson. I'm from Brazil. And about the healthcare here.
Yes, tell us about the healthcare and maybe about the cost of healthcare.
Yes, basically everyone has to pay for their healthcare, but because the government offers the system, a health system, but it's very poor. So people often go to private hospitals, private entities. I don't know how to say. Private places.
Yeah, like private doctors. Okay.
Yeah.
So the government does offer free healthcare or public healthcare, but the quality is very bad.
Yes, exactly.
Okay, I see. And what about the private hospitals and private doctors? Are they very expensive?
Yes, they are very expensive.
So it's a problem.
Yes, it's a problem for us. A lot of people don't use them, and it has to, how to say it, the most of people settle for the poor healthcare, public healthcare.
Yeah. Okay, I understand. So let's go next to, we have Adriana. How are you? Are you there? Okay, maybe you're trying to set up your microphone. Let us know when you're there, okay? We'll go next to Fabricio. How are you?
Hi, I'm fine. I'm Fabricio from Argentina.
Okay, very good. Nice to see you. So tell us a little bit about the healthcare in Argentina.
Okay, well, here the healthcare is quite poor, the one that is provided by the government. And sometimes the doctors there are not well qualified. For example, here in my home, there is only a very little hospital. You don't have all the facilities, for example, to to make all the studies you would need, for example, to check your health. So you have to go to a big city in order to make them.
I see. And is it similar maybe to Brazil, where you have public and private hospitals?
There are both here, but I think that it's better to have a private one because the professionals there are well paid and they work better.
Okay, very good, very good. Next we have Harrison. Are you with us?
Yes.
Hi, how are you?
Fine, thank you. I'm Harrison. I'm from Colombia.
Okay, very good, very good. So tell us a little bit about the healthcare and maybe healthcare costs in Colombia.
Okay, healthcare in Colombia is very bad. There are a lot of disparity between poor people and rich people, and how the government, the program for the government is very bad. For example, many poor people died in front of the hospital because the hospital don't care the people, don't cover the people.
So if they can't pay, then there's no options, right?
There are private hospitals, but are very expensive. The doctor, the medication are very expensive, and poor people obviously cannot afford for private hospital.
Okay, yeah, very good. And let me ask you, are the public hospitals free?
Okay, it's kind of free. You have to pay for a little payment. You have to pay short, but the medication is too bad. The attention is bad. The quality for the hospital is really bad.
Okay, I see. Okay, next let's go to Adriana. Are you there? Your microphone may be muted. Try to unmute your microphone. You may have to click on the upper right-hand corner of your screen. There's a little microphone there. Let us know if you get it fixed. We'll come back to you, okay? And Mustafa, are you there yet?
Yes, can you hear me?
Yes, now we can hear you. So tell us where you're from.
I'm from Egypt. I'm 26 years old. I'm working as a network engineer, and actually I missed a lot of your conversation, so let me ask you what we're gonna be talking about now.
Yes, okay, so today's class is about healthcare. We're going to read an article about healthcare costs. So can you tell us a little bit about the healthcare
Okay.
in Egypt?
Healthcare in Egypt. Actually, I have nothing to say about this subject, as it varies from family to another according to their income, financial income. So there is no certain case of healthcare in Egypt. So it's according to your money, you can get your healthcare.
Mm-hmm. Okay, so there are no public hospitals then?
Like public, yes, sure. There's public hospitals, so poor people can have their healthcare.
Okay, yes, but you have to pay if you want better healthcare then.
Sure.
Okay, very good, very good. And Adriana, have you figured out your microphone? I'm sorry that we're having so many technical problems in this class, but hopefully we can continue. It seems like we're having some connection issues. But we'll go ahead and start with the article. So let me put it up on the screen, and I'll also post a link in the VerbLink chat. So here's the link. I'll also post it in the Google chat just in case. Okay, and I'll let you read a section, and after you finish, I will let you know if there are any pronunciation mistakes, and we can go over the section. So if you have any questions, you can ask, and we'll be discussing the article throughout. So let's start first with Fabricia. Would you like to read us the first section?
Okay. Okay. Give a surgeon the choice between a $5 silk stitch and a $400 staple to close up an incision, and he'll choose the $5 stitch, right? Not necessarily. The problem is, most surgeons never know that the stitch costs $5 and the staple costs $400.
Okay, very good. The only pronunciation correction that I have is this word staple. Staple.
Staple. Okay.
Okay, perfect. So are there any questions first before we discuss this paragraph? This is our introduction paragraph, so it's going to give us an idea of what the article is about. Are there any vocab questions?
Yes. What is a staple and what is a stitch?
Okay, good questions. So can anybody tell us what a staple is and what a stitch is?
I think a staple, I don't know if there are more than two meanings, but I have a stapler. A staple is the thing that is inside it that we use.
Right, exactly. Perfect that you have your camera working now so we can see your stapler.
Yeah.
Okay, yeah, so a stapler is the metal, or a staple is the metal that holds sometimes paper together, but in this case, you can use a staple to hold an incision together. Okay, so it's the same idea, but in this case, it's a staple used on your body to hold an incision. Okay, so that's a staple. And what is a stitch? Does anybody know what a stitch is?
Maybe a thread.
Right, right. It's like a needle and thread. It says a silk stitch, so it would be silk thread that holds the incision together. So the silk stitch costs $5, and the staple to hold your incision together costs $400. Do you see Fabricio?
Yes, thanks.
Okay, yes. So what is the article going to be about, do you think? Why are they suggesting that healthcare is so expensive?
Sometimes doctors are not concerned about the costs of the things they use in surgeries.
Right. Exactly. So the last sentence, it says, the problem is most surgeons never know that the stitch costs $5 and the staple costs $400. So sometimes maybe they just are unaware of the cost. Okay, very good. Any other questions here? Okay, let's go to the next section.
I have a question.
Oh, go ahead.
What is the difference between close and close up?
It's basically the same thing. So to close an incision or to close up an incision. The same meaning.
Okay, thank you.
Okay, so Harrison, would you like to read us the next one?
Okay. Traditionally, knowing the cost of a stitch or a bone crew or any of the thousand other supplies used during surgeries hasn't been part of many doctors' medical consciousness.
Okay, very good, very good. So this last word right here is consciousness. Consciousness.
Consciousness.
Okay, perfect. What does that mean, consciousness?
Is lack of conscious?
Right, or thought, right?
Awareness, maybe.
Okay, right, awareness could be. So the cost of these stitches hasn't been part of many doctors' medical consciousness or awareness. Okay, any other questions?
No.
Okay, let's go to the next section. Let me see. Sorry for the delay. Jean-Marc, would you like to read this one?
Yes, healthcare costs aware have grown to massive 2.2 trillion of years to continue. Don't think. Yes.
Yeah, go ahead.
Don't think the way we oops. Why my microphone why?
Yeah, let's let Jean-Marc read. Try not to mute the reader. So go ahead, Jean-Marc.
As oops, sorry. As cost aware have gone to massive topic 2 trillion always to continue. Don't think the way we always don't then consensus medical provider have not chosen but to confront cost lazure of bacon getting by there to the slow deterioration of American electric car system.
Okay, very good, very good. So let's look at a couple words. Jean-Marc, look at this word conscientious. Conscientious. It's a tricky word.
Conscientious.
Okay, very good. Okay, and we have deterioration. Deterioration.
Deterioration, alright. Me
Okay, very good.
in England, I am go to best because I am disabled people. He is the best center for disabled people with career in England.
Mm-hmm.
He's a
Okay, yeah.
vitalist.
So there's better healthcare in London.
Yes, of course, that's right.
Okay, very good, very good. So let's look at this paragraph. Are there any questions here? Are there any vocab questions?
Where medical cost slow deterioration of America is no good in America for disabled people.
Okay, yeah, it says the slow deterioration. So it says the healthcare system is slowly deteriorating or getting worse in America. This is what the article says. Okay?
I have one question.
Sure. Oh, Adriana, we can hear you now.
Yes, it's fine.
Very good.
Thank you. Well, I don't really understand the part that says become guilty by standards.
Okay,
Or
yes,
become
it says,
guilty by standards. I don't
so
know what that means.
bystanders is, what does it mean, bystanders? Does anybody know?
Maybe sorry, I forgot.
To be a part
Okay.
of this without doing anything, just looking at this situation, at this issue without doing anything.
Right, exactly. So a bystander is a person who watches or looks at a situation, but doesn't do anything about it.
Oh, okay. Thank you.
Maybe a witness. A witness.
Right, it could be a witness of something. So somebody who sees or looks at, watches something, and doesn't do anything to solve it. So a guilty bystander is somebody who maybe has a responsibility to do something about the situation, but chooses not to.
Thank you.
Okay, very good. Any other questions?
Medical providers are doctors and nurses.
Medical providers could be anybody related or anybody in the medical field.
Okay.
So not just the doctors and the nurses, but the people who are higher up in administration. Okay, any other questions? Let's go to the next section, and maybe after this one we can discuss a little bit. Hello, welcome to the class. Okay, let's go. Next we have Mauricio. How are you?
Hello, I'm fine, thanks.
Good,
And
nice
you?
to see you. Where are you from?
I'm from Brazil. I'm Brazilian.
Okay, great. Would you like to read us this next section that starts with meaningful change?
Okay. Meaningful change, however, just a minute, please.
Can you see it?
No.
Okay, if you click my screen on the bottom, you'll be able to see it. Okay, can you see it now?
Yeah.
So go ahead and read us this section.
Meaningful change, however, can only come with knowledge. Believe it or not, most hosts don't know it's
Did you lose the presentation again?
yeah.
Okay, would you like a link? I can send you a link in the chat. There's a link to the document, okay? Okay, can you see it now? Okay, we lost him. Okay, Wanderson, would you like to read us this one?
Yes. Meaningful change, however, can only come with knowledge. Believe it or not, most hospitals don't know what it costs.
You've been muted. Can you unmute yourself, Wanderson? I'm so sorry, everybody, that there's so many problems in this class. I hope that we can get through it.
Yeah, I will start over again.
Okay.
Meaningful change, however, can only come with knowledge. Believe it or not, most hospitals don't know what it costs them to perform common procedures. But at the Cleveland Clinic, we've made it a point to know, asking our physicians to deconstruct the costs of their top 3 procedures, to record the price of sutures, count how many instruments were on the table, tag the devices on the shelf, and record how long patients spent in post-anesthesia care. Once the details are in, it's easy to see where to cut costs.
Okay, very good, very good. That was a long section, but let's look at some of the words in here. I wanted to point out the pronunciation of this one, procedures. Procedures.
Procedures.
Okay, so yes, and the other one was to deconstruct. Deconstruct.
Okay.
Okay, everything else was good. Are there some vocab questions? I'm sure there's some. What are some vocab questions here? Anything?
Hello.
Hello, how are you?
Hello, Mr. Me.
Hi, how are you? Do you have a question? I hope you can hear.
Fine.
Okay, very good. So let's look at this section. Let's look at what it is saying. At the Cleveland Clinic, so this article is written by either doctors or administrators in this Cleveland Clinic. So what is it that they decided to do in this clinic? Anybody?
Yes, me.
Go ahead, Adriana.
Well, I understand that they decided to know about the cost of the three more important procedures, medical procedures, to know how they cost. So they say that record the price of sutures, count how many instruments were on the table, check the devices, and to help to, I don't know, to know what the cost was for these 3, I don't know, the 3 more common procedures, medical procedures.
Right, exactly. So they took the 3 most common medical procedures.
This is very similar.
And they wanted to find out exactly how much they cost. So what do you think about this? Do you think that it's strange that they didn't know how much it cost?
It seems like it's very I don't know how to say. I don't know if that is the right way to know the cause. There are other ways. For example, in any business, you have to not to put the things on the table, but to know how they cost, how long they can be used, and I don't know how many procedures they have in a month, for example, and to make um, a, a sheet of the cost. I don't know.
Mm-hmm. Okay, so maybe there could be other ways that they could figure out the cost.
Yeah.
Okay, any other comments? Any other comments about this section? What do you think about the way that they find out the cost of these procedures?
I think that, for example, if you count how many instruments are on a table, you don't have anything because you don't have the costs of them individually. You only have an amount, a number saying, well, when we perform this operation, we have only 10 instruments, but maybe one of them is too pricey, too expensive. I think that they have to talk to suppliers or maybe to someone else, to the drugstores maybe, or someone.
Mm-hmm. Yeah, so maybe they might need to get some more information other than just knowing how many instruments they use. So if they don't know the exact cost of these procedures, then what are they charging the patients? What is that cost of the patients based on if they're not 100% sure what the true cost is? What do you think?
I think they invent a price.
Yeah.
Maybe.
So if they don't know how much it costs, maybe they're just picking a number, right?
Yeah, and I think most of times it is it's more expensive than it should be because it is invented.
Mm-hmm. I think that may be a problem, that they don't know the true cost of things, so they just charge you a whole lot of money and just pick a price and you have to pay it. So maybe that could be a problem with this system as well. Okay, any other comments or questions? Let's go to the next section. Adriana, would you like to read us this one?
I will read. Can I read?
Well, we'll see if Adriana, are you there?
Can
Is
I
your
read?
microphone muted?
I have some problem. Sorry. Yes.
Okay,
I'm
no
here.
problem. Go ahead.
3 years ago, we challenged ourselves to save 100 million by focusing on how and what we buy to stock the hospital with needed equipment and supplies. The key was to meaningfully engage doctors. Now, as part of the purchasing process, dozens of doctors gather to discuss the merits of certain products. Which ones provide the best outcomes for patients? How many are needed? How much does it cost?
Okay, very good, very good. So it's still talking about the writers of this article at the Cleveland Clinic trying to save money. Where can they cut costs? So they challenged themselves to save $100 million. Okay, what do you think about their tactic to try and save money? What did they try and do to save money?
By focusing on the procedure of buy the things they need for the hospital.
Right. So instead of having maybe suppliers to automatically supply different things, they had a team of doctors who knew about the needs of the patients and which supplies would be best for the patients. Okay.
Yes.
So good. Do you think that this is a better way of buying supplies?
I think that is right, but it's very important to be also focused on the quality of the products because it's about healthy
Mm-hmm.
issue. So that's very important. It's not about the low prices, the low cost. Not only that.
Right, exactly. So when you're talking about something like healthcare,
Yeah.
you want it to be affordable, but you don't want it to be poor quality. Right? So you have to find that balance.
Yes.
Any other comments?
I think I think it's a good way for them to do this because not only they can know the certain products they need, the exact products, but also they can how can I say, combine a price, decide on a price for just one price for every doctors to use.
Yeah, so maybe they can have standard prices for procedures instead of just charging whatever they want.
Yeah.
Okay, so good point. Any other comments?
Hi.
Got a lot of noise. Make sure to mute your microphone if you have some noise on your microphone. Okay, we'll go to the next one. And of course, if you have other comments, you can make them. Fabricio, would you like to read this one?
Yes.
Okay. Take for example nitric oxide, a drug commonly used in heart, lung and chest surgeries to keep tissues well supplied with oxygen during the operation. When it's effective, it's very effective, but it doesn't help all patients. When we realized we were spending $2 million a year on the drug, we drilled down to see who was using it and why.
Okay, very good, very good. Any vocab questions here?
Drug. Yes, drug.
Drilled?
Drug.
Okay, so it says we drilled down to see who was using it and why. This is a phrasal verb, to drill down. What do you think it means to drill down?
Like to focus on?
Right, exactly. So we drilled down to focus on this issue and find out why it was being used so much. Okay, good. Another phrase you may have heard is to get to the bottom of something. So you're drilling down to get to
Well
the bottom.
split.
Right, or to find something out. Okay, any other questions?
Yes. Well split.
Well supplied. Well
Yes.
supplied. Okay, who can explain this one? Well supplied.
Yeah, to provide a good amount of oxygen.
Right. It says to keep tissues well supplied or to provide them with enough oxygen.
Yes, thank you.
Okay, very good. So let's have the next one read. Fusi, is that how you pronounce your name?
Yes, I can.
Okay, you can read us this next one.
We found that doctors and our staff did not have a standard protocol to guide them on when and how much to rely on nitric oxide. We had to educate them that if the drug didn't work within a half hour of being administered, it won't work at all. So repeated doses were wasteful. That result, nitric oxide use dropped by half, saving $1 million. $1 million without any adverse effects on patient care.
Okay, very good, very good. I'll point out a couple words. First of all, this one in the first line is OR. OR. It's an abbreviation. What does OR stand for? Anyone? Does anybody know? OR staff. It stands for operating room. Operating room. So we found that doctors and operating room staff did not have a standard protocol. Okay, very good. And look at this word, doses. Doses. Okay, just wanted to point out the pronunciation of that one. Are there any questions? Any questions here? Anybody?
Drop by is like to reduce, right?
Exactly. So it says the nitric oxide use dropped by half or was reduced by half. So in this case, how are they saving money? What is it that helped them to save $1 million?
Developing a standard protocol so the staff know how to use this, I don't know, this item for real.
Right, exactly. So developing a standard protocol or educating the staff on how to properly use this chemical is what helped them to reduce the cost. And at the end it says it saved $1 million without any adverse or negative effect on patient care. So that was our concern. Adriana, you had mentioned that sometimes, even though it's good to provide affordable health care, you have to make sure that you're taking the patient's health into account. So that's the most important. And the key is to find ways that you can make healthcare less expensive while still providing good quality care. Okay, very good. So what do you think about this tactic to reduce the cost of healthcare? This tactic would be better education for the staff.
Yes, of course. Of course, it's a good thing they did. However, it's very, I don't know, I'm very worried about this place because medical institutions are supposed to know and to work under a standard protocol for every procedure there.
Mm-hmm. Yeah, so it is kind of concerning that they didn't have a standard protocol at first.
Yes.
Yeah.
Yeah, anybody else want to comment on that? Do you agree that it's concerning?
I think that they are talking about this nitric oxide that maybe it's not taught at university, doctors' university, you know. So sometimes this knowledge came from the experience, and it could be brought to the doctors for those who have experience.
So maybe this knowledge is something that's not taught in the universities or in the training. Okay,
Yeah.
make sure again, I'm gonna say to mute your microphone if you're having some noise so that we can hear the other students. Okay, any other comments? Any other comments about it?
Well, I think about this. Sorry, it is a lot of noise. Can you hear me?
Yes, we can hear you. Go ahead, Jorge.
Okay, well, I think that this part, sometimes this kind of knowledge is gathered while you are getting more practicing in the area. So maybe the doctors that are working on the clinic or this health care institute, they are maybe not that. They don't have the enough practice on these fields, so they don't know this kind of knowledge. So maybe they need to keep practicing to know and identify those kind of things that might reduce the costs.
Yeah, so maybe it's the experience that helps to let them know how to reduce the cost of these certain things.
Yeah.
Okay, very good, very good. Any other comments? Okay, let's go to the next section then. And we have Heber, how are you?
Great.
Good, nice to see you. Where are you from?
I'm from Brazil.
Okay, great. And would you like to read us this next section of the article?
Can I start?
You're having some problems with your microphone. It's difficult to understand.
Okay, my microphone is not good.
Okay, we can kind of hear you. Can you see the presentation?
No.
Can you see the article on the screen?
Yes, I can.
Okay, would you like to read us this section that starts with "That was one"?
Okay, that was one of the modifications made in the OR, but each hospital department is different. In some, price lists are taped to supply cabinets. In others, posters remind everyone to choose supplies carefully, stressing this message. Without compromise, quality, cost-effective alternative.
Okay, very good, very good. So let me point out a couple pronunciation points. So this one right here is taped. Okay, so don't add that extra syllable with the ed. Make sure to make it one syllable, taped. Okay?
Okay.
And also this word right here, compromising. Compromising. Okay, everything else was good. So are there any questions here? Any vocab questions?
What cost-effective alternatives mean? Cost-effective.
Okay, yeah, somebody in the class wants to answer that. What does it mean, cost-effective alternatives?
with a good cost. In this part is related to to balance between cost and quality.
Right, exactly. So it says, without compromising quality, consider cost-effective alternatives or other things that you can use that would be more affordable or cheaper. Okay?
I have a question.
Go ahead.
I don't want to understand the part.
Sorry, a lot of noise.
This part. In some price lists are taped to supply cabinets. I don't understand what that means.
Right, it says in some, what it means is in some hospitals. In some hospitals, price lists are taped to supply cabinets. So you can see the lists, the price lists of everything that is in the cabinet on the cabinet. And that way when the doctors are grabbing for something, they know exactly how much it costs before they use it.
Okay. Like make them consciousness.
Right, make them conscious or make them aware of the price.
Okay.
So do you think that's a good idea to have the prices posted everywhere?
I don't think so.
Why is that, Wanderson?
Because I think only the doctors should know this information, and they could have this on computers, on a file, not everywhere.
Why do you think it would be bad if everybody knew the cost?
Good question. Let me see. Because maybe they could call on a discount, ask a discount. I don't know.
Yeah, they could maybe try and get a discount.
Yes.
Okay, but wouldn't that be good for the people? It's an opinion, so there's no right answer. But what do you think? Anybody else? What do you think? What do you think about the posted prices?
I think it is a pretty good strategy. The only downside that I see on it is that maybe sorry, can you hear me?
Yes, we can hear you. There's a lot of noise. We're going to reach you. But go ahead, Jorge.
Okay. Well, what I was saying is that maybe this is a pretty good strategy because everybody's gonna be aware, as you said, about the prices that they need to use on the products. But the problem with this is when they are going to update this prices list, it's gonna be a mess with all those lists taped in all the hospitals. So maybe the updating of this, if this is done on paper, it is gonna be difficult. Maybe if it is done in some digital media, it is gonna be easier.
Okay, yeah, so that's a good idea. If you had it digitized, it would be easier to update because these things are always changing prices.
Maybe they would have more costs impressing. How can I say that? Using I forgot the name of the thing.
Describe it for us, Wanderson. We'll get it.
Printer. Maybe they would have more costs with the printer, with papers than with,
Yeah, so maybe it could cost a lot to print out all those sheets. Okay, anybody else? What do you think?
What I think is that I don't agree with that thing because doctors and the staff have to be focused on the procedure more than on the cost or the things that they need. Like, and it's like just to follow the protocol, not to focus on the cause and all that. I think that can be like a distraction for them. That's my opinion.
Yeah, that's a good point. So maybe if the doctors were always aware of the cost, they might focus on that more than providing the best possible care for the patient. Okay. Does anybody agree with that? That might become a problem? Or want to comment? What do you think? Anybody? Okay, maybe not. But if in that case, we'll just stop there because we are out of time. Are there any last comments or questions before we leave? What did you think about the article as a whole?
Very interesting.
Yeah, provided a lot of different strategies that this particular clinic had used to save money. And maybe some of those are good ideas, maybe they're bad ideas. It is an opinion. But anybody else have a comment on the article in general?
Yeah, maybe yes, because I am disability, I am concerning. But me, I am go to 20 years in England for my holiday.
Okay, yeah, so go ahead.
It is very nice because I have a musical for physically people and two people and play music and it's very nice.
Yeah, so it's an interesting topic for you, and also it might be interesting to learn about more specifics of the system in England.
Yes.
Okay, very good, very good. So we will stop there. Thank you everybody for joining us in the class and participating in the discussion as well as reading. So I hope you have a wonderful day. Hope to see you in future classes and take care, okay?
Okay, thank you. See you later.
No problem. Again,
Thank you.
sorry
Thank
for
you.
all these technical
Hi.
problems, but hopefully we'll get it sorted out, okay? So everybody, bye-bye.